Dear colleagues, best regards from Zagreb. It's a very sunny day. It's a very sunny day in Zagreb. I'm in a very good mood because from last time when we were hearing each other, it was 10 days ago. The situation from COVID-19 virus is getting better in my hometown, and I am very happy that today morning I was visiting my dental office and met my team, and I'm very happy that in the next few days we will start our dentistry, our daily work. I missed very much my daily routine, and I can't wait to start to live my normal life as I lived before this epidemic situation. I'm very happy that we can see each other. It's better to say that you can see me, but I hear it's a very nice attendance of this webinar today, and it makes me very happy. And that I would like to thank to all the people from KaVo Care company, especially Polish crew who invited me for this next webinar, and I'm definitely sure that we will have very nice period of 1.5 hours. We'll see how many times we will spend speaking about aesthetic dentistry powered by dental microscope, or by using all other optical devices in the clinic. So I would like to start to represent myself. I want to speak before when you see this video. So this is where I work. I didn't speak when there was video was going, because last time we had some problems when I speak through the video. So I will announce you before the next video will start what you will see on it in furthermore. So this was my. I want to represent myself. This was my practice situated in Zagreb. This is my dental team. I always want to announce how important it is to have a good colleagues around you, and they can implement our daily work, each of them with their own skills. And all products you will see today, when I say product, I mean all new smiles, all nice work. This is the result of the whole teamwork, and every one of us put a little small piece or some bigger piece of influence on this in our dentistry, in satisfaction of our patients. So we have 4 dental units. All my dental office is equipped by KaVo Care. 2 dental units are 1058 primes, 2 are E70. Of course, like a microscope is part of the KaVo Care company, and I'm KaVo user for many years. This is the schedule of our webinar today. This is at the beginning. I will explain you why I bought microscope, why I'm using microscope in my dental work. At the very beginning of my when I bought it, why I decided to buy such a for we can say expensive device. Where in dental medicine we can use it mostly. In my practice, we use it in endodontics and of course in prosthodontics, but sometimes we use it in periodontology and of course in restorative dental medicine. And after that, I will show you 3 nice cases. All cases. This is the first case, the second case, and the third case. They all are prepared by using dental microscope, and I'm pretty sure that I can't achieve such a good aesthetic outcome without using an optical devices. So these two pictures which you see on the right, let's say three pictures. One is the one picture is one microscope, and this is very important picture for me because on the picture above, this is for the first time, and I was sitting on the one dental unit by using a dental microscope. This is in IDS in Cologne 2013. It was now 7 years ago. This is first time when I was trying to sit under the microscope, and first time that I had experience of magnification on the dental phantom. So it was very exciting experience for me. I remember after I left the stand, I was the whole day thinking about magnification. That was much more influence of buying microscope on me was the magnification. There are many advantages you will see further on in the presentation by using microscope, but magnification is first time which came across to my mind when I was want to buy. The second picture is when this is the one course which I was attending in Milagnano in Italy. This is Dr. Massironi. He had this course had a great influence for me as a doctor, as a prosthodontist. It was a very intensive course for 3 days, and this when I was driving in Zagreb after that course, I decided something which I was thinking about a lot of period before, that I will buy. I need microscope. I want to improve my practice. I want to be a better prosthodontist, and I think it was a very good decision. We will speak about how a microscope we will use in all branches of dental medicine, and it will be interesting topic for comment. Is it really aid, or is it sometimes just a marketing tool? I think this is a question which is bothering many of you today. Microscope is not cheap device. It's for buying a microscope. You can buy, let's say, one new dental unit, but when you buy it, I have now 4 years. This is my microscope. There are no any retrofit expenses in the lifetime, and there is, I think, only one time my man who is taking care of my equipment just came in my office and said, "Okay, please just take a look at microscope." He said, "No, I don't need to look at you. It's no need to say it." I just want to tell you, I forgot to mention it in the beginning. All the questions you will send, I can see it right now, so we will discuss it everything, please, in the end of this presentation. When we speak about when you want to achieve more quality in your dental work, I'm now speaking mostly in prosthodontics, to be more accurate, to be more efficiency. This is a very good, very good tool for enhance all this which what I mentioned. It's very important for when you are touching something, especially in this Corona period. It was now, of course, important even before that the design of my microscope, design of Leica, is very good. There are no cables around you. It's very good for the cleaning and for whole environment, clean environment, which we are working in our daily practice. And of course, for your colleagues, for your assistant, they can do good disinfection of all instruments. The documentation is very important part for my practice, because without documentation I wouldn't be able to perform it today with this presentation. Leica has a perfect let's say documentation part. It has integrated HD video system, which all data are saving in a memory card. Also, you will see very good photography you can shoot with the microscope, and of course there is no need to when you are working on a big magnification, it's very it's priceless for the practitioners who is working, that you are not moving, that you are fixed. So if for example, if you need to capture the video or picture, someone put the finger on your microscope, everything will be a little bit shaking. So we have a good remote controller, and your second assistant is in charge of this remote controller. So we use a lot of documentation for lecturing, for presentation by using microscope. Illumination and optical quality is, as I mentioned in the beginning, this was magnification was the most important thing when I was buying microscope, because I didn't unfortunately I didn't have experience like you have today to listen. To that time there was no many lecturing and no many information about practical use of microscope. And I was thinking only I want to see wider, I want to see under the magnification. So magnification is 6.4, 10, 16, 25, and 40. Mostly I work on 10 or 16 times, because when you do endo, it's very good to have opportunity to use 25 or 40 times magnification. The most valuable thing on this microscope for me is multifocal objective. It means that when you focus on the patient, when your tubes are 20 or to 30 centimeters from the field of view, and you don't need to move up and down the whole microscope, because you just have only one tiny screw, which is multifocal objective, and this tiny screw will make your picture on the microscope sharper as much as you need. So ergonomics is a part which, when you're speaking about when you're reading in the literature, there are many articles which are announcing the advantages of microscope. This is the ergonomics is one of the first. It's not, to be honest, when you're sitting for the first time, it's not easy to start to work with microscope. You have to train yourself, you have to train your team, and there is a totally different way of working. But when you get used to it, as people had to get used to not everything, when you have some new device, you will see how common is and how comfortable is to work it, and this satisfaction which you have after you know how to use it is for me is priceless. So when you compare it for example with the dental loops, there are many. I also using loops. I was starting to using loops maybe a few months before I bought the microscope. I didn't bought any of these devices because I not seeing good. I was thinking at that time that I want to be better. If I want to be better, I have to see better. So no, there is no device for if you have some eye problems, but it's a device to improve your practice. I want to compare it with the loops. There are no possibility by using microscope that you have some cervical injury, because when we are doing with the loops, we are all shaking our head in many different ways. I'm the first who is doing it that way. And there is, by using loops, there is unique magnification. If we speak about advantage, its only advantage is because it's much cheaper than a microscope, but there is no ranges of magnification. And of course, when you speak about illumination, there is a totally different, it can go in the same sentence in the microscope. So where in dental medicine we can use the microscope. As I told you, it depends of preferences of the practitioners. For in our practice, we use it mostly in endodontics and in prosthodontics. As I don't work endo in my office anymore, this pulp chamber which you see on the X-ray was when we had a patient for the first time in our office. You see on the X-ray here, he has some pain in this under this bridge, and we removed the bridge, and there was you see this tooth wasn't endodontically treated before, and for it was normally for expect this is the first upper molar. It has 3 root canals, maybe some accessories, 4th or something. But this my doctor who is doing endo, she was switch on the microscope, and she found 5 root canals. So it is a very good tool for when you have problem with the accessorized root canals, accessorized root canals, and when you enter in the pulp chamber with the microscope, there is totally different world, and you see how much you don't see in the general. We use it also sometimes in the restorative dentistry. We are using for the caries detection, something for caries removal. I was in the beginning when I was buying, when I had a young patient with very big caries lesions. I was using microscope for caries removal just to be more precise how close I am to the pulp chamber. Of course, we use the same preparations, and all layering of composites, all layering of direct restorations can be done under microscope, because Leica has, as you see, orange filter, which you can do the bonding and layering of the composite materials, not to have it polymerized. You see on this first molar how caries is detected when you switch on the microscope. You will see the one of good advantages of the microscope is that confidence when you can give to the patients. And this is the part when we will speak at the end, when I will speak at the end about is it sometimes a marketing tool. People like when you show them and something under magnification. People like when you when they can say that their dentist are doing everything under microscope, so you can get some respect from a patient because you are using and you are working under microscope, under magnification. It's also very good. I forgot to tell you when there was a slide about communication. It's a very good tool for the communication with my dental team, especially when I think with my dental technicians. We can very clearly see the preparations, comment where to prepare more, where to prepare less, because microscope he is giving you control. It's very good when you can all your preparation. Generally in life, it's good to control things and gives you some power. And in dentistry, everything which is done under microscope, it is full vision controlled, and it is priceless for, I think, for every practitioner. I don't use it especially in periodontology or implantology. This is one time when I was some checkup with one of my patients. This implant, they were 4 or 5 years after insertion. So the screw, I had to screw it a little bit more, and I remove it just to see how healthy my gum is, how soft tissue are looking for, and it's very nice I'm using just for in periodontology or implantology, just to show to my patient how good it looks. It's very nice message when you send them on the WhatsApp or when you on the email, how their implants, which are life guaranteed, how they are looking good, and all the prosthodontic part and the soft tissue and so on. As I'm a prosthodontist, I was buying this uh, device just for prosto at the beginning, just for prosto, and I'm using in the I'm using it in all the part of prosthodontic, from cords, cementation, preparation, uh, application of the impression material if you do it on the analog way. Now you will see four short movies where you can implement your microscope in all branches of not to say branches, in all prosthodontic part. I won't speak during the movie because you won't hear me. So very quick, we came to our first case. As you saw it, there are very nice look when you working under magnification. Now, to be more concrete, I will speak through my cases, how I use my microscope in prosthodontics. So this is the first case. This is one very nice young lady. She was 36 when she appeared in our office, and she was my patient for a long period of time, and we were very often, when she was visiting our office for the checkups on for some smaller treatments, we were all, many times speaking about her anterior teeth and how she's unsatisfied with the shape and how unsatisfied she is with her uh, left upper incisor. So there the finally the time came when she decided to improve her looks, and she was in our when we were speaking about what to do, how she want to look. She was, I remember, telling me, my teeth are very masculine. I want to have much more volume in my anterior teeth. I hate my left rotated incisors. I'm too old for orthodontic therapy, because she has some in the, you'll see some crowd in the lower jaw, especially in the anterior part. And we had the same approach as we have in all my aesthetic treatments. This is mandatory wax up and mandatory mock up. So when we did the wax up and we put it in her mouth, I sent her as I mostly do, for 2-3 days home, and she appeared after 2-3 days in our office, and we started to therapy. This is her preparation look like. So as you saw, this is how I will speak today. The topic is microscope and work under magnification. So about just a little part of preparation. This is how I prepare for veneers. You saw one quick video, and this is how most of my preparations are looking like. Some people ask me, am I using very often silicone key, or do I prepare only by using mocap? I mostly prepare by using mocap. Of course, sometimes we use a silicone key, but you know what is the problem when you are working at the magnification? If you're using a mocap, you have to remove your head and see how the mocap. If you're using a silicone key, you have to move your head, and you have to check how to control your preparation. When you are using, and it's very hard for your eye. It causes generally the fatigue of your eyes, and it's for me much more easier for by preparation to using a mocap. This is very nice preparation. I'm very happy to see. You see how untouchable animal is here. Every tooth has the part of untouchable animal. Even this rotated incisor, which was for at the beginning, I was, to be honest, wondering, can I solve it by the veneer or by the preparation? This is very nice for me preparations. You see, very small in the cervical part. I just showing the borders to my dental technician. We are already very good team, and I punctually know where I have to remove by using this ceramic or by using some other ceramics. This is all part of our plan before, which ceramic will we use. And this picture is very nice for me, because this is documentation even for me, even for the patient, that very small part of the animal was sacrificed and was removed by to achieve a very high aesthetic result, as you will see after. We were using here lithium silicate veneers. It depends on the situation when I choose to use feldspathic or to use lithium silicate. Lithium silicate is very good material, because you can mix it by using this. It has a very good flexure strength, good aesthetic properties, and for me, I didn't have in my lifetime any problems with lithium silicate, because it has a long clinical longevity, and I'm using it, of course, very often. And this indication, there are only two approaches by using ceramics for me. One is feldspathic, and other one is lithium silicate. So this is very also nice work of my dental technician, and this is I want to say we shoot approximately 200 to 300. We capture 203 between 200 and 300 pictures per such a case, and I always pick one of the pictures who is my judge. I think this picture in this case is punctually can judge me. This is on the right side, this is cemented veneer, and on the left side, this is just the preparation. You see the same translucency of the ceramic and of the tooth, the preparation, the shine of the enamel of the preparation, the shine of the enamel of the ceramics is almost the same, and I'm very proud when I achieve such a nice preparation like this is. So this is situation before, this is situation after. You see below, very nice shape. She was primary. She wanted to achieve a better shape of the tooth. Of course, the color and was the secondary in this case, but the shape was something which was bothering her a lot. This is recall pictures after a few months. Very natural look, very nice ceramic, very nice smile, and I think it looks very naturally. And she was few weeks ago, before we stopped of this period under control, and she told us that she is living every day like she is very happy, and she is looking herself in the mirror every day, and she's very satisfied as we are with this very natural look and work. The second case was something similar, because just only because we used the same ceramic as in the first case. This is also one young lady. She was 38 when she appeared in our office. In the past, she had orthodontic treatment. She's a heavy smoker, and you see his periodontal, the bone level, and his, you will see even on the pictures, his periodontal situation is not so good, and she won't quit to smoke, but she came to improve the shape of her central incisors, and there were two problems, on this central incisor for her statement, for her point of view. The first one was the shape, and the second one was this black triangle. This black triangle, when I was, you can't, before you start to work, you can see immediately what's the problem about this. There was a big problem from the bone, and the approach to this patient would first, you won't miss if you do the CT scan, and I didn't do the CT scan because she refused to speak on this way, but there is very volume of the bone is very reduced here, and she just wanted, I don't want the surgery, just I want to increase my central incisors. So when I did this is the one part. The second part, the problem was, you see this diastema on between the second premolar and the first molar. She, when she was using, when she was wearing braces, when she was in the orthodontic therapy, and the therapy finished and the diastema remains. So I'm planning a lot. So this is the treatment plan, is my basic part of my therapy, and I very often do my treatment planning after I finish with my daily work at the evening. And I didn't want, because I want to perform the modern dentistry. I have good materials, good adhesion methods for today, and it was for me unnecessary to prepare the whole tooth on the when we speak about premolar, molar, and molar. And I planned this, exposed to my dental technician, and she said, I think she's listening now, but she will, I can comment after, she will break it. It's not a good decision in this part, do the fragments, because it's the first molar, the central of collusion. I said, just do it. I think it will be okay for the future prognosis. As I mentioned 2 slides before, lithium silicate is a very flexure strength material, and I was using things for the bridges in the posterior region. If it's not recommended, I never had I had only one bridge which is broken, but it was my mistake, because I think I didn't it was from the occlusion part. I should reduce occlusion on this, so it's not the topic for today. But lithium silicate is the perfect material for flexure strength, when you speak about flexure strength, and when you speak about optical characteristics. So this was planned, you see in the walks-up, it was planned for anteriors, and it was planned for posterior. This is the initial situation, and I was doing this preparation. I was using a Heidemann instrument, which removes, I speaking about anterior incisors with the anterior part, the central incisors. I was, put my border of the preparation a little bit inside of this papilla, because I spoke with my dental technician. She saw, now, of course, all these pictures before I start preparation, and I told her we have to, to pump this papilla with the ceramics, and I will put the border of the preparation, I will put it a little below the gingiva enamel border. So on this is the initial situation. This is the right upper incisor prepared, left unprepared, and this is, you see how tiny preparation is here. The contradiction with this situation, you see the second class composite here. It is very tricky to, very risky to perform with the ceramics when you don't have some as much enamel surface. But my plan, you saw it on the walks up, was here to increase the surface of the enamel, and I ignored this composite, to be honest with you. And I like to test my creativity, to spread my borders by performing dentistry. So this is 2 months, I think more than 2 years in the mouth, and there was no problems with everything. So these are preparation, as you see on the upper slides, and preparation of the molars on the lower side, lower slide. This is I only reduce a little bit the surface of the enamel. This is almost non-prep, almost non-prep situation. So this is the preparation. You see now how the border of the preparation is going a little bit below the papilla. Preparation again, and this is the final work. You see how nice their fragments are done. This is also done by my the same dental technician, Daniela Modric, and she done again one perfect work. Even we in the beginning didn't agree with this situation. When I was preparing for the incisors, I reduced enamel a little bit more than we had on the wax-up, because I thought it will be, I have enough enamel, and I couldn't be in this particular case much more minimally invasive, let's say on that way, but it was easier for my dental technician to finish this nice work. So this is very nice, again, photos of before and after situation. I'm very satisfied with this outcome, because 2 years after, the situation is the same like today. And you see, maybe you'll see on the next slide, how invisible this border of the ceramic fragment and the enamel it is. Perfectly, you can see from this intraoral picture, and you see the whole arch, how nice the diastema is closed. And even when I'm looking on it, it's very hard to see that there is no natural tooth instead of the ceramics. So this is her smile after on our checkup, on our control, and this is how very nice artistic photographies, which we do very often after we put the veneers in our patient mouth. So very nice smile, very natural incisors. We are all satisfied. She was, as you saw, she had some stripes on the lateral incisors, but this was not what was bothering her. She only had problem in this shape, and I'm very happy also with this case. The third case also was, I think this is impossible to do without the using magnification. This is very young guy. He was, you will see on the X-ray how healthy teeth he has. He has maybe 3 direct restoration in his mouth, and he was very unlucky. By watching the football game during the World Cup 2018, I was performing with this case in one study class, so maybe my colleagues saw it, but I didn't speaking about using microscope in this case. I was recommended to him by one of my colleagues. He appeared in her office, and she called me that he has some specific situation, and she has no idea how to treat this case and how to treat this patient. So he appeared in our office with the situation like this. This is caused by the bottle, and what to do. There is, you'll see now, there was, I was, the thing is, not of his age because he's only 28, not of his dental status. He only has some just 3 direct restoration on the molars, but he is also performing on the commercials. He is some kind of model and or actor in commercials. So it was very for his very big tragedy for everyone, especially for this young guy. Most of people in this situation will be using direct restoration composites. I'm not such a big fan of composites. I want long-term solutions, and but if I use composites in this situation, I wouldn't fail. Why not? Because you see, this is the key picture of the whole case. I have exposed dentin. I have almost, you see how pink on the central part is, I see the pulp chamber, and composite in this case will be cheap, fast, and quick solution. I took a time, 1 or 2 days for this planning. I also call this is the lower jaw. With lower jaw, we did it with direct restorations. I call my colleague who is very good in this, and he did this lower part. This is my plan for this therapy. I was calling, and that time I called my dental technician. I sent her immediately the photos. I said I had one special idea. You will see how to approach to this problem, to this situation. And she was very exciting of my plan, and the plan was not to be my golden rule in the preparations, in the using is to stick to the animal. When you doing veneers, when you stick to the animal, you can miss it. The veneer will fall down. So my plan was this. I increase the surface of the animal. This is the microscope picture 10 times magnification. And this is the key of the success of this therapy. I explained to the patient before, you are very young, you are very handsome, you are had the bad luck for getting a bottle in your incisors. So if I want, there is many methods today, many ways to approach in dentistry, in modern dentistry. So I want to to prepare the whole vestibular surface of your tooth, but you have to know that I skip some rules because I have exposed dentin a little bit, and why I decided it was, you have to be afraid to have sensation after this. I left him for 2 days, and I do this all without anesthesia. So it was some answer to me. There is no, maybe it won't appear in the future. In this case, we had, especially he has a luck, because it is now, it will be 2 years in June, how we solve this problem, and it's still remaining. We give him some notes how to treat by chewing the food, and we don't have a problem. We still have safe fragments cemented in his mouth, and they are looking, as you will see furthermore, very good. So I explained to him, if it fell down, we will do the full veneer, or give some semi-crown veneer, because there is many tooth of the fracture, but we won't prepare the whole tooth, for the crown. But you have to know that it can be fell down. I'm not the magician that I can know that, but this is my approach for you. So this is very nice microscopic picture under 16-time magnification. You see how how much more the surface of the prepared animal I have on the lateral incisors than on the central. And lateral incisor wasn't the problem. This is 25 magnification and 40-time magnification. So we have, as you see on the microscope, very much of the surface of the animal, much more it is look on microscope than by the naked eye. And this is preparation from the oral part. You see how I increased the surface, and this is the key of success of this therapy. In this is I think this is the master work of my dental technician, but you will see by on the next slide. We use feldspathic fragment. I think it was very perfectly done by Daniela, and now it's coming the worst part in my practice. This is the bonding part. I will repeat like I repeated like what I said on my first webinar 10 days ago. I would like only to do preparation, and when the bonding part is coming, I would like to call some of my members of the team, but it's impossible, of course. So it's not easy to bond it. Now that I'm doing it tonight, I will do it with the Nexus of 3rd generation cement, because it has light cure. It comes into option to light cure and dual cure. I will use it light cure because I want to have many time and to fix it. You will see how I did it. And this cement is very, it has a very long-term color stability, very good aesthetics part. It comes in the 5 shades, and it shows very good performances by using in our practice. Bonding part is very hard. If you have experience with such type of restorations, you will see, I only saw it once in one very small study club. It was the similar case was done. My Romanian colleague, he showed it, and he done it almost the same way. And I asked him how you repolish when you cement it. It's very hard to repolish immediately after the bonding, and to have to achieve the same shine between enamel and between the feldspathic fragment. And he told me, you will see, when every year you will have to repolish, because when the patient are brushing their teeth, there is no there is different wear on which is caused by the toothbrush on the enamel and on the ceramics. So now you will see how it looks in his eyes. I think it's a perfect outcome, minimally invasive, very modern, powered by optical devices, used by perfect ceramic. This is creation by Willy Geller, feldspathic ceramic, and the very lucky for me, their cementation was passing wood. Now you see the wear on the central incisor, very tiny border, but it is impossible to see with the naked eye when you're speaking. I'm showing you now the very high quality intraoral photographies, but this is, I think, very good work of our team. From this point of view, I think it's impossible to, from the palatal view and the occlusal view, it's impossible to notice that it's a feldspathic ceramic fragment instead of the natural tooth. I think this all can be done without using optical devices, without using microscope, because when I was preparing, I can't remember punctually, but about 40 minutes I prepared these 2 fragments, maybe half an hour, 40 minutes. When you do it under the microscope, you can, all the time, all the way of the therapy, all the way of the preparation, you can control situations. So I was using 16-time magnification, then I switch on 25, I switch on 40, how it looks like. There is the surface of how much did I increase the surface of the enamel. It will be enough for dental veneer. So microscope is very, very good device. This is composite done by my colleague Ivan, very nice direct restorations, and this is situation before and after. I'm very, very happy with this case, and this is how the smile of this young fellow is looking today, and I'm very happy that I didn't have to you know, re-cement it or change the weight for a full vestibular veneer. It is remaining, and I'm very happy as he is. So for the conclusion of this presentation, I would I think all of us who is dealing with aesthetic dentistry on our daily basis, we want to increase our looks of our increase our work to improve much more our aesthetic outcomes of our patients, and I think it's necessary to using optical devices, especially microscope. When I was attending all my courses across the Europe, all the clinics which I was visiting, this is 5, 6, 7 years ago. It was very interesting for me that every modern clinic, it has at least 2 microscopes. One is in the endodontic area of the office, and one is in the prosthodontics. So this is how I start to think about buying a microscope. You will see when you spoke about, is it a marketing device or is it aid? For me, is first of all is aid, because I think I'm a better dentist when I control all the stuff which I can see in under any type of magnification. One my colleague, he's maybe also listening this. We were together on this course in Melegnano, and he was sending one sentence, very short and very clear, that how to translate in English, the things you can't see, you can't treat. It is very good sentence, very short sentence, and you will see much more. You will see the influence. All of us, we are living, we are paying our bills by how many tooth we produce, as good as that we will live much more better. The influence of the patients is also, by using microscope, is also one topic which we can speak about it, because they're feeling very comfortable, you know, when they came and when you show them the picture, especially when in our practice, we have one habit that we, at the end of the therapy, send the patients to WhatsApp few pictures, and we send it on the WhatsApp, and we said this is before or after, and you see how many animals we preserve by in your therapy. This is almost untouchable tooth, and you have very good outcome. And you see, they're always afraid how many animal will be reduced by using microscopes. So by doing preparations. So this is also one marketing tool, but it is topic for some other webinar in the future. I hope you enjoyed this presentation. This is my contacts. If you have any questions, if you're not inspired by the questions right now, you can send me. If you need some advice by this equipment, or if you need there is no stupid questions in dentistry, so you just contact me on one of these addresses, and I will be very happy to answer you. So thank you for your attention. It's very hard to when you don't see the audience in front yourself, to say thank you. But I hope you enjoyed. We had 1 hour of very good aesthetic dentistry, and now I will switch my presentation to see your questions, or there is any questions to answer. Thank you. So, is there? Okay, as I don't see any questions, I think Darius, we can to switch off, huh?
Stop button.
Yeah, I think you can, because there is no question.
Okay, thanks a lot. Enjoy your evening. And
Okay.
goodbye.
Okay, we hear each other. Bye.